breast reconstruction is a very difficult and complex reconstruction. You need to really understand the concept, the need, the goal and expectation of the patients. Now, some plastic surgeons do offer only implant-based reconstruction, which limit option in their hand. So the surgeon who were able to perform or offer different kind of reconstruction, whether it's the implant reconstruction or autologous reconstruction, tend to have more options that could offer for the patient to get the maximum results that they're looking for. Based on my experience, unfortunately not. The patient already stressed with diagnosis breast cancer. They would then refer to the plastic surgeons. Now it's up to the plastic surgeons going to say, unfortunately not all options were offered to the patient. The patient tend to pretty much go along with the flow with what plastic surgeon would like to do. In my practice, I almost always offer all reconstructive option, including implant reconstruction, autologous reconstruction, or both. We will break into two types. First type we call a pedicle flaps. Basically, you may have heard about a pedicle tram reconstruction. That's autologous reconstruction when we swing the lower abdominal tissue with the muscle to the chest. The second one is a tissue dorsi flap. Basically, use the muscle and skin from the back, rotate anteriorly to the front to create a breast mount. The second operation that I do a lot, and many places here, major center in the United States offer, is a microvascular reconstruction. So basically, we transplant, we detach the skin and fat from one location, detach from the blood supply, put on the chest, reconnect the blood supply, and shape the tissue to make them look like a breast. And that's quite lengthy operation. In my hand, for one side reconstruction, take about 4 to 6 hours of surgery. For bilateral breast reconstruction, approximately 6 to 8 hour operation. And the recovery time is longer, approximately 6 to 8 weeks. The DIEP flap, it's a really great operation. First of all, we take the tissue, the skin, and the fat from lower abdomen, and then we dissect the blood supply with preservation of the muscles. So we preserve the muscle versus the tram, the pedicle tram flap, in which you actually sacrifice a significant amount of muscle. So the DIEP flap, you can get the tissue, the fat, and the skin without losing the muscle. That's the first benefit. The second one is probably the most rewarding for the woman. You get a free tummy tuck. So you get nice and tight abdominal wall, and we can create a waistline that some women were looking for a long time. So that's the two benefit of that reconstruction. The third one, importantly, is the lifelong reconstruction. This reconstruction is your own tissue. There's no foreign body in you. You don't need to worry about implants gonna rupture or cause a delay complication. So for those reasons, in my opinion, the DIEP flap should be a flap of choice for those women who are good candidates. So basically, you get more natural results. If done properly by appropriate training surgeon, the DIEP flap could be very safe. The success rate in my hand is 99.6%. You get more natural result. It's soft. You don't feel like a rock on your chest. And it feels very natural compared to implant. However, having said that, the implant is nothing wrong with implant-based reconstruction. I still offer implant-based reconstruction for those who, for some reason, cannot take time off, or those who don't have enough tissue, those mom who still need to go back to work, or the lady who sometimes still want to get pregnant in the future. So there's some patient implants may be more appropriate But like I said, in my opinion, that the autologous reconstruction is a method of choice for breast reconstruction. If you're a woman within a healthy condition with a little bit excess lower abdominal tissue with a good anatomy, for example, a C-section, hysterectomy, if those operations was performed and they don't cause any injury to the vessels, everybody could be a good candidate for DIEP flap. There's no study to show that age has a negative impact on the outcomes. So anybody who's fit, who a good candidate for any surgical operation, is a good candidate for breast reconstruction. In my practice, we keep the patient in a bed rest in the intensive care unit just for overnight. Most women will spend approximately 4 to 5 days in the hospital, and they will release home post-op day number 5. We instruct them not to lift anything greater than 10 pounds for approximately 6 weeks. And approximately about 8 weeks, most women will go back to work and resume their normal daily activity. I see a lot of patients who are really motivated. They live with a flat chest for a long time, and now they have breasts, and then they feel good about themselves. They start going work out and exercise. That could cause problem if you work yourself too much earlier. You could cause abdominal weakness. Remember, even though the DIEP flap, we don't take the muscle with us, we still injure the muscles. So we need to allow the muscle to heal, and the fascia that cover the muscle needs to heal first. So for that reason, I recommend not to do any strenuous exercise for approximately 2 months. I do offer we call revision of reconstructed breast and symmetrical operation. And in my opinion, almost all women require a secondary surgery either to match the other breast or what's called nip and tucks. And very commonly, I perform a fat grafting procedure in which we perform a suction lipectomy, aspirate excess fat along abdominal wall. Then we inject the fat to different tissue along the chest to create a symmetry.